43.5 million people have given unpaid care to an adult or child over the last 12 months. That's according to the Family Caregiver Alliance. These people, known as caregivers, provide daily, living, and medical care.
But care is not complete without addressing the needs of the caregiver. That's why UT Health San Antonio School of Nursing is hosting workshops to support them. GMS 8 9's Tiffany Huertas has a look.
Part of the workshop, we also offer the virtual dementia tour, which is a simulation exercise for family caregivers to go through. They put on some equipment, and what it does is it really tricks the brain so that it takes you to what it might be like to live with dementia for 6 minutes.
These are just some of the lessons at this month's Caregiver Skills Training Workshop and Virtual Dementia Tour hosted by UT Health San Antonio School of Nursing.
Caregivers learn about home safety, how to transfer someone as they are less able to mobilize on their own.
The workshop started in January 2018. Caregivers receive on-training from health professionals. Dr. Carol White, professor at the School of Nursing at UT Health San Antonio, says caregivers are doing more than in generations before.
Managing complex medication regimes, giving injections, things they never did in the past, and they take this on without any training.
The demographic of caregivers is also changing.
So on average, caregivers are around 60 years old. They're about 65 to 70% females still. It used to be higher, but more men are taking on the role.
Dr. White began studying how to help caregivers after seeing the effects in her own life.
Our neighbor was looking for help because his wife had early onset Alzheimer's disease, which was hardly known then. But when I saw his distress and his stress in terms of how he was going to care for his wife as a young nurse, that really piqued my interest in family caregiving.
Dr. White says through these workshops, caregivers gain confidence in their role and decrease the chance of their own diagnosis like depression and anxiety.
It's to prepare caregivers to safely manage the caregiving role.